fortunate to be alive. I have a precious human life. I am not going to waste it, says Dalai Lama. Indeed, life is precious, the most prized gift bestowed on us. Yet, in our daily quest, somehow, this precious gift gets compromised. The clutter and din of our life, both professional and personal, take a toll of our health and well-being. And anxiety and stress compound this gift. Sadness, feeling low, and having loss of interest or pleasure in daily activities are familiar feelings for all of us. But if they persist and affect our lives substantially, then there may be issue of depression. Depression is an ongoing problem, not a passing one. In addition, there may be feeling of withdrawal, a loss of energy, a change in appetite, sleeping more or less, anxiety, reduced concentration, indecisiveness, restlessness, feeling of worthlessness, guilt, hopelessness, and thoughts of self-harm or even committing suicide. Over 8 lakh people die due to suicide every year globally. It consists of episodes during which the symptom lasts for at least 2 weeks. It can last for several weeks, months, or even years. Depending on the number and severity of symptoms, a depressive episode can be categorized as mild, moderate, or severe. Some types of depressions are unique to females, such as postpartum depression or premenstrual dysphoric disorder or postmenopausal or premenopausal depression. Apart from change in brain neurotransmitter levels, environmental factors, psychological factors, social factors, genetic factors may be cause of depression. Sometimes some type, apart from change, it can be treated by family support, counseling, or visiting psychotherapist or psychiatrist. But in our country, we have to understand first that it is a mood order which needs to be treated. Despite advancement in society, we generally tend not to talk or discuss about it because there is a lot of stigma attached to mental health condition. The Indian government's commitment is reflected in National Mental Health Program, which encompasses life skills, training, and counseling in educational institutions. Workplace inclusion of mental health in the Sustainable Development Goals has brought new hope and enhanced visibility to mental health as a public health priority. It is imperative that we make lives around us happier and healthier in our homes, in our neighborhood, and at our workplace. But the question remains, is it sufficient or we need more intervention at government as well as NGO level? To know all this, we have two very reputed doctors with us. Our first guest today is Dr. Monika Singh, consultant clinical psychologist, Landmark Hospital, Sector 33C, Chandigarh. She has 34 years of experience in Department of Psychiatry, PGIMR, Chandigarh Medical College and Hospital, Patiala, and General Hospital, Sector 16, Chandigarh. In addition to Fatah Academy and Indian School of Business, Mohali. Our second speaker is Dr. Anil Goyal. He has done his MBBS and MD in psychiatry from Government Medical College, Patiala, and worked for Government Medical College, Patiala from 1982 till 1998. Thereafter, he has started his full-time private practice at Bhatinda, and he is a well-known name there. Now, let me call upon Dr. Anil Goyal first to understand the cause, symptom, and other aspects of depression. Dr. Anil Goyal.
Thank you, Dr. Jyoti, for the introductory thing. First of all, I'd like to congratulate Mr. Vishal Agarwal and his team for this wonderful program. This is need of the hour. At the same time, I must thank him for inviting me to this program. We had been deliberating upon effect of Corona and lockdown in the last couple of days. Corona and lockdown has affected mental health at large, world over. But the second aspect, the lack of awareness amongst society about mental health and depression in particular, was discussed. So this topic of depression, its consequences, prevention, suicide came into our mind, and here we are. So what is depression? Depression is an illness. It's an illness. ये बीमारी है. जैसे कि डायबिटीज एक बीमारी है, हाइपरटेंशन एक बीमारी है, आर्थराइटिस की बीमारी है, किडनीज की बीमारियां होती हैं, ऐसे ही दिस इज आल्सो एन इलनेस. दिस इज नॉट एन इंडिकेटर ऑफ वंस एनवायरनमेंट. उसकी वातावरण का इंडिकेटर नहीं है कि डिप्रेशन, उसकी फैमिली का, उसके फाइनेंशियल स्टेटस का इंडिकेटर नहीं. दिस स्पेयर्स नोबडी. मे बी ही इज रिच, पुअर, of any ethnic background, of any religion. Maybe he's famous, maybe he's very, very important person in society, maybe very rich. Maybe the person is well adjusted, very happy, well placed. It spares none. It can happen to anybody. Even the mental health professionals, they are equally prone to this problem as the general public is. According to the latest data available, 6 to 7% of the world population do have depression at any given time. Who are the people who are more prone to it? कौन लोग हैं जिनमें ज्यादा हो सकती है, जिनमें होने की संभावना ज्यादा है? First and foremost is family history, heredity. It runs in genes. This is an illness which runs in genes. General population, probability of having depression is 6 to 7%. If one of the parents is having, the chances increase to 15 to 20%. If both the parents are having depression, the chances of persons getting depression increases to 40 to 50%. Every second child is going to have depression if both the parents are having. So it's very important. Marital counseling के time पे it's very important to have these two psychiatric ailments. At least both of them should not have the same illness. And then gender. Females are twice more prone to depression as men. Age group. Usual starting time of this illness is around 30 years. And again, that the second spike comes in the senior citizen, 60 to 65 years of age. This is an illness which, if occurs, can recur. So it implies, if I say it recurs, it implies two things. Anything which recurs has to first get off. एक बार ठीक होगी तो वही तो दोबारा रिकर करेगी. So ये बीमारी ऐसी है, of its own भी ठीक होती है, लेकिन दोबारा हो सकती है. It can recur every 6 months, every year, every 2 years, maybe once in lifetime. But there is probability of recurrence is very high. If you are having a first episode of depression, chances of having second episode of depression recurrence is something like 50 to 60, or some study says 60 to 70%. But if you have had 2 episodes of depression in your life, chances of the third episode increases many folds, maybe something like 85-90%. Then it's little more common in lower socioeconomic strata. Negative life events, stressful life events, they do increase the probability of getting depression. There are certain medical ailments, diabetes mellitus, thyroid. Both these ailments, they have patients suffering from diabetes or thyroid, or even any chronic ailment. Chronic ailment is which is long, continuous, debilitating. Chances of depression increases. Then how to recognize? हमें कैसे पता चलेगा कि किसी को डिप्रेशन? First and foremost symptom of depression is मानसिक उदासी, sadness. It has got 3 grades. I'll say it's not something very, very scientific what I'm talking, but there are 3 grades. Number 1 is low mood, then sadness, and then clinical depression. Clinical depression we use when there is illness, जिसको हम बीमारी कहते हैं, डिप्रेशन का रोग हो गया. So low mood is very common. All of us do have low mood over small events, small quarrel in the family, small loss, or even you miss something, you're going to have a low mood. थोड़ा लगता है कि मन उदास सा है, but it gets off. अपने आप ठीक हो जाता है. Then there is sadness of mood. Sadness of mood can happen after so many comparatively bigger events like a loss of job, or bereavement, death of somebody, or in a situation like this, corona or lockdown. This has increased the incidence of depression many folds. But if it's limited to sadness, sadness is proportionate to the event. If it becomes disproportionate, then might be we are labeling it to depressive illness. It is short-lived. Only the sadness is short-lived. It's proportionate to the event, to the loss or to the damage, and it's short-lived. Short-lived maybe one month, 1.5 months. If it goes beyond that, and if it's disproportionate to the event, to the causative factor, we'll label it as clinical depression. Second most important feature of depression is lack of interest, lack of enjoyability. किसी भी चीज में उसका इंटरेस्ट कम हो जाता है, इवन इन एंजॉयबल एक्टिविटी. किसी से बात करने को दिल नहीं करता, टीवी देखने को दिल नहीं करता. You don't like to read newspaper even. He may stop enjoying food. There is a decrease in appetite. And then there is altered sleep. नींद कम हो जाती है. Especially patient may be able to sleep at his right time, but there's early awakening. रात को 12-1 बजे नींद खुल जाएगी, 2 बजे नींद खुल जाएगी. And after that the patient is little more worried as put in the day, because he feels कि अब मैं क्या करूं, रात को नींद नहीं आ रही. Then patients have excessive thinking. ज्यादा सोचता है. There is a complaint. Patient कहता है कि सर दिमाग थक जाता है लेकिन सोचना बंद नहीं करता, रेस्ट पे नहीं रहता कभी. There's a lot of worrying. छोटी छोटी बातों पे चिंता ज्यादा करने लगता है. The boy has gone to school. He's supposed to come back at 3:10. At 3:15, the patient becomes worried. क्या हो गया? जल्दी जाके देखो, कभी तक नहीं आया. And to combine both of them, there is a negative thinking. Late हो गया तो कुछ बुरा हुआ होगा. So that comes into the mind of a depressed patient. This lack of energy. कुछ करने की हिम्मत नहीं रहती. Patient बहुत जल्दी थक जाता है. This is inertia. Patient कुछ नया करना, patient के लिए कुछ नया करना बहुत मुश्किल है. To start a new thing is very difficult. दिन शुरू करना बहुत मुश्किल है. Patient become indecisive. उसको कुछ फैसला करना तो बहुत ही मुश्किल. उसको he loses the decision taking power. There could be retardation. Retardation meaning the by वो कम बोलता है, ज्यादा हिलता जुलता नहीं है, बेड पे रहता है, constipation हो जाती है. His movements are slow. His responses to queries or general talk delayed and short. Then there's a very peculiar feature in depression. Depression when starts has a diurnal variation. Diurnal variation meaning it's more in the morning hours. And as the depression increases, it start going on to mid-morning, then noon, evening, late evening, and become pervasive. Say a normal cause of depression. Early on, the patient is depressed only in the morning hours. कहते हैं कि morning बस एक बार नहा ले तो उसके बाद ठीक हो जाता है. They attribute it to the bathing, whereas the things are कि depression के features ही, depression का जो mood low वाला feature है वो रहता ही morning hours में. उसने अपने आप ठीक होना है, नहाए या नहीं. Along with these, there is a very high degree of hopelessness. मेरा क्या होगा? this वर्थलेसनेस, मैं किसी लायक नहीं हूं, मैं कुछ नहीं कर सकता. These are core depressive symptoms, but depression is never independent. This is always comorbid. Along with the depression, there is always anxiety. घबराहट बहुत होती है ऐसे पेशेंट्स को, बेचैनी बहुत होती है. They're irritable, they're quarrelsome. टीवी चल पड़ा तो उनको पसंद नहीं है, तो बंद करने के लिए बोलेंगे, तो देन they become very restless. बंद कर दो इसको. I've seen a lot of people fighting, lot of domestic disputes only because irritability, because of depression, which is a treatable cause of marital disharmony at times. These all are symptoms of moderate depression. If the depression becomes severe, the patient can go to stupor from retardation. Stupor is patient is almost motionless, doesn't speak a word, or the patient can have guilt. मेरे से गलतियां हो गई, मैं पाप भुगत रहा हूं, मैं पापी हूं. Patient can become paranoid. He becomes suspicious. People are talking about me. My spouse is not loyal to me. People are conspiring against me. And then the patient can start having suicidal ideation, planning, attempt, or even, I'll say, many people commit suicide. Depression is the commonest, but not the only cause of suicide. These are few things I told about who can have depression and how to recognize depression. Then there are few important aspects of depression. I'll explain number wise. Irritability. Irritability is one factor which I have seen in my clinical practice of 40 years, that it can cause family breakdowns, it can cause divorces, it can cause job losses, it can cause school failures. The patient becomes irritable. The other person doesn't understand that why is irritable. So there is family fighting, violence, and ultimately I've seen people divorcing only because of one person's irritability and other people not understanding it. So this way it becomes a treatable cause of divorces. Second is the diurnal variation I told you. It's more severe in the morning hours. All of us start our day during the morning hours. If the patient is depressed in the morning hours, तो उसको उठने को दिल नहीं करेगा, तैयार होने को दिल नहीं करेगा, ऑफिस जाने को दिल नहीं करेगा, स्कूल कॉलेज पढ़ाई के लिए जाने को दिल नहीं करेगा, ट्रेनिंग के लिए जाने को दिल नहीं करेगा. The family feels that he doesn't like the job, he doesn't like the, so they'll start thinking job change or college, which is not the right answer. The person is going to have the same feeling in the morning hours, even if they change the job or even if they change the course, school. I've seen people shifting houses, I've seen people shifting cities only because of this, getting transfers and all that. And then there's very, very important aspect of it. Early on depression, which is say not highly, evident. The patient is depressed. If the patient is depressed, depression is of say mild to moderate grade. It's not recognized by family, but it does decrease the performance of the person, academic, professional. So your performance at your office decreases, you fail in your school course, and after that you become clinically evident depressed. Depression increases. the family or the people around you, the friend circle, they start blaming the failure. वो फेल हो गया इसलिए डिप्रेशन हो, उसको नौकरी से निकाल दिया इसलिए डिप्रेशन हो गया, उसको प्रमोशन नहीं मिला इसलिए डिप्रेशन हो गया. Whereas this may not be the cause of depression, this might be the effect of depression. So herein all these 2-3 points I'm trying to emphasize to detect early depression. Only the family can detect that. Because if recognized early and treated early, people can live a normal life. They may not have to change jobs. I've seen people leaving jobs, resigning from jobs, foregoing promotions, foregoing courses. People get admission in elite schools and they leave it only because they are not able to perform because of depression. Then there is Dr. Jyoti did develop on this aspect, depression and pregnancy. This is a very important component I'm talking about. Depression itself is a very big stress. If you enumerate the severity of the stressful life events, maybe it will come like third or fourth. Especially so in the first trimester. Second trimester is completely happier lot. So if you are stressed because of pregnancy itself, it's going to be an risk factor for developing depression, number one. Number two, if you are depressed, already depressed, and unplanned pregnancy occurs, you are on treatment, you cannot stop treatment, but at the same time, your medicine are going to affect the child in your body. So all depressed patients, we advise not to go for unplanned pregnancies. They should complete the course of treatment, which usually lasts 9 to 15 months. And after that, we gradually taper off the medicine or keep the medicine to minimum possible level and comparatively least toxic to fetus. And they can carry on. They can plan a pregnancy. And second aspect is postpartum depression. Postpartum depression is after the delivery. That's seen as something like 30 to 40% of the females after delivery, they have postpartum blues. As I said, low mood. It's very common, but this lasts about 8 to 10 days and it wanes off. But 10% of the people, or the not people, sorry, 10% of the postpartum ladies after childbirth, they go into postpartum depression. This is full-blown depression, needs treatment as any other depressed patient. I have already told you about the recurrence of depression. It's a recurrent disorder. If it occurs once, it can recur. If it occurs twice, it is going to recur again. There's very strong family history in depressed patients. And next chapter is depression and suicide. Depression is one of the commonest causes of suicide. Of course, it's not the only cause. There are other causes as well. According to the latest studies, something like 10 to 12% per lakh they commit suicide every year around the earth. This rate is higher in men. 18 men commit suicide in per lakh in a year, whereas females they commit less. So that's 6 per lakh. All patients who commit suicide, they have, all depressed patients who commit suicide, they start with the ideation of suicide. They first have the idea. इससे अच्छा तो मैं मर जाऊंगा. Then they start planning, मैं कैसे मरूं. Then they attempt it, which may or may not. be successful. Most of the people who commit suicide, they have shown their intent. They have verbalized their intent. उन्होंने घर वालों को बताया मेरा मरने को दिल करता है. And in all completed suicide, the family is guilt ridden. उसने बोला तो था हमने ध्यान नहीं दिया. So I'll like to warn that if there is a person in the family who is low and he's shown his intent to commit suicide, don't take it lightly. It should be taken very seriously. This is like an avoidable emergency. Then what are the risk factors? कौन लोग हैं डिप्रेशन में जो सुसाइड कर सकते हैं? Sex, definitely males are more prone to complete suicide as compared to females, whereas females are 4 times more common to attempt suicide. Their attempts are not that serious. Maybe they are less violent against themselves. Then severe the depression, higher the chances of attempting suicide. If there is a poor social support system, the person is single, unemployed, low socioeconomic status, bereaved, bereavement, after bereavement, anniversary deaths are very common. Anniversary blues, anniversary depression, and anniversary deaths are very common. Anniversary meaning the anniversary of the spouse death. Unemployed, underemployed people are more prone to. If there is guilt in depression, the patient is guilty. उसने कुछ गलत काम हुआ which may not be as wrong as he feels. If there is agitation, a depressed patient who is retarded is less likely to attempt suicide, because suicide ultimately is a very violent act which is directed against the self. The people with coexisting chronic medical problems are more prone to attempt suicide. If the people, they start thinking poor of themselves, मेरा कुछ नहीं होगा. So these are few things which are predictors of suicide. And then if the person has already attempted a suicide, second attempt can be more serious. If there is a family history of suicide. So these are few things which makes a person more prone to attempting or completing a suicide. So they are warning signs. What can a family do in a depressed suicide patient? First of all, suicide is something which can only be prevented. There's no treatment for this, as we all know. We must know how a person can attempt a suicide. Hanging is very common. Then poison by insecticide, pesticides. Jumping in a canal, jumping in lakes, jumping from high buildings, jumping before a running train. This is unique to India. Nowhere else on this earth people attempt suicide by jumping before a running train. This is highly, highly violent. Firearm, slitting wrist, arteries, taking overdose of medicines. So these are the causes. These are methods by which people commit suicide, attempt suicide. And to prevent suicide, we have to be cautious about these things only. To prevent suicide, first of all, full support, social support, medical support, 24/7 विजिल. मैं कहता हूँ छुट्टी लेके 1 महीने के लिए इसकी चौकीदारी करो. घर में कोई फायर आर्म नहीं होना चाहिए. There should be no insecticide, pesticide, poisons. No medicine should be there. If at all, they have to be kept in home. It should be kept lock and key. His room, his bathroom should not have latches from inside. Because if he attempts in a ziffy, and you should be able to approach him and save him. Dr. Monika Singh is going to dwell upon this aspect of suicide prevention and family support in her talk. And then there's certain things which a family or social support system should do and should not do. These again will be talked in detail by Dr. Monika Singh. It's her field. She is really expert on it. So listen to her carefully. Now we come to the management part of depression. You'll be surprised to know all psychiatric ailments treatment is far less expensive as compared to all other medical problems. It's the least expensive of all treatments because there is no investigation, practically no investigation, no invasions, very few admissions, no procedures. Medicines, psychotherapy, maybe something. So I told you there are three methods of treatment. First and foremost, definitely will remain medicines. Second is non-pharmacological treatments. दवा के बिना बातचीत से इलाज. Third is ECT. So let's start with give a brief introduction of medicine. Medicines are mainstay of depression treatment. They have the latency period. If you start treatment on day one, the effect, antidepressant, mood elevating effect will start say after 3 weeks. In the meantime, we have to give other supportive drugs so that his anxiety level decreases, he is able to sleep properly, something we give so that he can eat well. Treatment effect starts after 3 weeks. Optimum effect is seen within 6 to 8 weeks. And treatment usually is given from 9 to 12 months period, say a year, in the first episode of depression. But if the depression is recurrent, it is coming, say every year, might be, treatment has to be given for longer periods. There are patients who need lifelong treatment. Second part of management treatment, non-pharmacological, बातचीत से इलाज. Dr. Monika Singh again is going to talk at length about this. Third method of treatment is ECT, electroconvulsive therapy, shock treatment. This has gone into oblivion because of the very name, shock, ECT, electric, बिजली लगाने का. But this is a wonderful treatment. This is very effective, very safe. This can be lifesaver, especially in very severe depressed patients, psychotic patients, when the patient is paranoid, suspicious. Patient is not responding to medicines, then there's no alternative with us. Patient refuses medicine, patient doesn't take medicine. We don't have any method, injectable medicines नहीं है हमारे पास. Patient is suicidal. Suicidal patient के लिए definitely it's a dire emergency. There's certain myths which are attached to medicinal treatment. Number one, ये नशे की दवाएं देते हैं डॉक्टर तो सुला देते हैं बस ठीक ठाक क्या काम है. That's purely a myth. I must admit, Darren, initially when we start the treatment, there's some sedation which wanes off gradually. By the time medicine effect comes, say 2 to 3 weeks away, उसका sedation level कम हो जाता है and patient is able to work normally. So now we have wonderful drugs which don't have sedation beyond 2 to 3 weeks. People can fly. It's the most active field where alertness should be of highest level. People can fly, people can operate, people can do anything with treatment. Second is side effects of the drug. Weight loss, weight gain. Weight gain is a conspicuous side effect of the medicine, we do agree. But if we start taking precaution from day one, the day we start treatment, to stop fats, decrease sugars, and start some physical exercise, this is minimized. And when the drug medicine level comes to optimum levels, say within 6 to 8 weeks, we start regulating the dose. So this is almost minimal. It doesn't increase after. Third very common thing is ये दवाएं सारी उम्र लेनी पड़ती है। हमने जो देखा है, उसको दवा शुरू हुई उसको सारी उम्र खानी पड़ती है। During the course of my lecture today, I told you this is a recurrent disorder. बार बार हो सकता है. There are patients who need it for very long length of period. जिस पेशेंट्स को साल में एक बार हो रहा है, 2 बार हो रहा है, every year 1.5 साल के बाद हो रहा है. So it's better to give antidepressants continuously rather than have a episode of depression. I'll say something like 15% पेशेंट्स ऐसे हैं जिनको लाइफ लॉन्ग ट्रीटमेंट लेना पड़ता है, whereas 85% पेशेंट्स का दवा बंद हो जाता है in due course of treatment. मैं एक और बात बताना चाहता हूँ here, and I want to just make you understand why treatment is to be prolonged. डायबिटीज क्यों होती है? We all understand. डायबिटीज होती है इंसुलिन की कमी से. जिसकी इंसुलिन बॉडी में बनने की क्षमता एक बार कम होगी, that's a lifelong process. So you will have to replenish it by insulin or insulin enhancing drugs for life. ऐसे ही डिप्रेशन भी कुछ ब्रेन में केमिकल्स की कमी के कारण. हम मेडिसिन देते हैं, वो मेडिसिन उन ब्रेन की केमिकल्स की कमी को पूरा करते हैं. बट ये कमी जो दिमाग में केमिकल्स की है, ये रिवर्सिबल है. इन 85% पेशेंट्स ये अपने आप ठीक हो जाती है, whereas in 15% पेशेंट्स ये कभी ठीक नहीं होती है. So those are the patients who need lifelong. So don't be afraid of it. इस दवा सारी उम्र खानी पड़ेगी. और second aspect is, if you're sick, you have to take it. If you're not sick, you will not be given. So this was all from my side. Now I'd like to hand over my place to Dr. Monika Singh, highly accomplished and very senior clinical psychologist of Chandigarh. She'll be covering the role of family, non-pharmacological treatments.
Hello.
Before I end, I must request you all, it's a Corona time, wear mask, wash hands, stay indoors, stay safe. Bye.
Thank you, Dr. Goyal. Thank you so much. We'll have a lot of questions, but at the end of it, so I'll now request Dr. Monika Singh to please take over and please to our viewers. Dr. Monika Singh, you can start, please.
Hello.
Hanji, we can hear you, ji. We can hear you. Please start. We can hear you.
All, thanks a lot for inviting me, Vishal. It's wonderful to be with you all, with all the advocates and the people in the legal this thing. And I'm so happy that this has been arranged. Thanks a lot to the doctor who introduced me, and thanks a lot to Anil who suggested my name. I was really looking forward. Now Anil has very nicely given all of you the signs and symptoms of depression. So I will not be going through that because those have been explained to you. But I do wish you to become very sensitive about these symptoms, read about them, so that in the house or when you're helping someone, you can provide help to these individuals very soon, and you can recognize these signs and symptoms. Now I'll start with, so there are various types of therapies that we do as a psychologist. So first of all, we also make, hello?
Yes, ma'am. I've started the slide, ma'am.
Yes. So first of all, there are lots of therapies that are there. There is individual therapy when we start doing the cases. There is group therapy if all the family therapy might be needed, where we speak to family members along with the person. And there can be some depression also in marital couples, so some marital therapy, or sometimes even in the community, there is a common thing which has happened. So we might go in for community therapy or milieu therapy. But in today's my talk, there are various other techniques as well, like the supportive psychotherapy, which I'm going to talk about. And now in this, I would like to tell you that there are various other methods, that is biofeedback, cognitive behavior therapy, psychotherapy, and now let's come to supportive therapy. Here, being supportive is, I would request that everybody be very, very supportive when you are dealing with a psychiatric patient. One has to show empathy. By empathy, I mean that you have to understand things from the person's point of view rather than what you understand. If you can say, हाँ मगर ऐसा तो नहीं है, उसके लिए शायद है, ठीक है, तो आप अपनी चीजें उस पे नहीं थोप सकते हो. Now, so first of all, depression isn't anyone's fault. It can happen to anyone. You have to separate yourself from the problem. Like, this is me and it is happening to me, right? Like any other problem, you have thyroid, you have a deficiency of iron, you have calcium deficiency, you have to take medications. In the same way, there is a dip in certain biochemical activity in the brain. And so if your brain is not making that chemical, that very important feel-good chemical, then you need to take care of it by understanding the problem and then going for help. So show concern and care for the person. Helping a patient with depression can be very challenging for the people who are providing this help. Okay, the sufferer can be having difficulty in connecting with others and at an emotional level. So it becomes even more difficult for the family member taking care, that you know how to get across to him. But if you are fit, then you can understand that the person can be hiding the problem. You all can also hide a problem. That nahi, kuch nahi hai, thoda aise hi udaas hai. You can make excuses. You can cover up the problem, but then the symptoms don't go away because of that. Your loved one isn't lazy or unmotivated. What you label as being lazy or unmotivated may be low psychomotor activity, which is a symptom of depression. So please understand this. Learn ways how to offer support, how and where to get help, how to help him cope with depression. So we go to the next one. Learn about depression. Do not underestimate the seriousness of depression. You have been told about the signs and symptoms and the warning signs. What is also important is how much is the duration of illness and whether the depression was sudden or it happened slowly. What were the triggers? Was there any stressful life event? Any family history of mental illness? Because one of the very important reasons that can be are due to a family history of mental illness it is genetic, can be genetic. Any previous history of mental illness, and also what are the personality traits of the person. If he was always a little introverted, quiet sort of a person, and there are easily touchy, easily affected by things, then there is already a little predisposition of the personality. That means he was already showing signs of uh, personality traits where he is unable to deal with difficulties very well. And also, what is his attitude? What are his beliefs and feelings? Next. Next, please.
The next slide is there.
Yes. So, first of all, express your willingness to help. The person who's a sufferer, express your willingness to help, encourage treatment, explain it's a medical condition and not a sign of weakness. Suggest seeking help from a professional, a psychiatrist, a clinical psychologist, or a mental health provider. Offer to prepare a list of questions. What are you experiencing? So you can jot down those. So whenever you go to the hospital to your doctor, you can easily say that this is what the person has been voicing. Next, prepare safe environment, like the doctor has already told you, and encourage him to stick to his medicine and therapy. Be willing to listen. Now, listening is a very important part of any counseling, any therapy. In between, do not jump in and say, "Magar aise bhi to tha." Apni judgments nahi pass kariye, because he is giving a vent to his feeling. That is his way of approaching. It is only later on that you can give awareness that maybe this could also be this. But in the beginning, to build a rapport, why will a person tell you if you are not a good listener? Right? So appropriate nods, appropriate whatever, little bit like that. But if you just say that, oh, your body language shows that, you haven't understood, it's not going to be taken very well by the person. So you are offering assistance, you are helping to create low stress environment, locate helpful organizations who can help, and encourage participation in spiritual practices and make plans together. Next. Now, how to start conversation with these people as a family member? How are you going to go about it? So some things that can be said very lightly are that I have been feeling concerned about you lately. And then tell him that, I've been observing, or I've noticed that some differences in you. And I was wondering how you are doing. Would you like to talk about it? So it's an open-ended thing. तुम ये नहीं करते हो, आजकल तुम उठते नहीं हो, तुम नहाते नहीं हो, तुम डाइनिंग टेबल पे नहीं आते हो. This is all blaming, and this will help you in instilling more guilt in the person. And as it is in depression, people have guilt. So we are not going to add fuel to fire. You can also say, I wanted to check in with you because you have seemed pretty down lately. When did you begin to feel like this? So that will give you how many days back. Did something happen to feel this way? How can I support you right now? So, have you thought of getting help? Next. Being supportive involves offering encouragement and hope to the person. So, if you are also down in the dumps, you are also crying along with him, he's crying, then when tough times come, then you have to take the responsibility and the onus of. So as family members too. You can't even belittle the person by saying, "Ye to oh koi na, ho jauga theek, kuch nahi, gham nahi laida," right? You do not know what kind of reactions can come out of it, because that's not empathy at all. If you can tell him that I'm there for you during this tough time, he will understand, he or she. It may appear hard to believe, but the way you are feeling may change. So there when you say that, you are giving him hope for the future. Something which he feels he's doomed, he can see the light at the end of the tunnel. You are important for me. You are important for me. Your life is important for me. So this has to be conveyed. Next, please. And what is it that you should avoid saying? I think this is very important. That it is all in your head. Everybody goes through tough times. Mujhe dekh, kitni problems aayi. Try to look at the bright side. Why do you want to die when you have so much to live for? Now we recently have, everybody is saying, the actor who committed suicide recently, that he came from humble beginnings, but see where he reached. He had women, he had money, he had this thing. But do you know, uski nabz mein kaun sa sensitive part tha? Where he didn't get help, right? Now, and these can be very impulsive decisions. Although there is this thing going on about the case, what led to it and whatever. But what I understood also is that he was going through psychiatric treatment. And so there was very high vulnerability at that point of time. And the least you can say is when you say, I can't do anything about your problem, apne aap ko khud se help karna padega. This is not the time for that. So an absolute no. And how do you, again, support him? Have very realistic expectations. You know, if he's not doing something, we have to also teach them that they also have to have less expectations from. For example, if I say, they're saying this about this person, he committed suicide. And so what were his expectations? That everybody will give him films to do? There is a big thing, how we expect. The more expectations we make, the less joy do we get. We can only provide whatever assistance the person may need, give unconditional support and love, and show compassion. Encourage activity. Encourage that he moves about. Now, why exercise and walking is important? Because when you do some activity, some brisk walk or something, you are raising the serotonin in your body. These are the feel-good chemicals. Okay? Deep breathing is very important. I will just tell you what kind of deep breathing you can do. Give positive reinforcement when even a small baby step is made. For example, if the person hasn't come, I've been told to please move the window. Is there a problem?
No, there's no problem. Please go on. Please go on.
All right, something is coming there. So now what I'm saying is, whenever the person makes movement, exercise, dancing, why do we feel good when we do balle balle and dance? Right? That is when our endorphins and serotonin levels go up. So this is but in making baby steps. So what I was trying to tell you is, suppose the person is not even taking a bath and he's just lying on bed. So first of all, just include him. For example, tell him, I'll just hold you and just sit on your bed with the back rested, only this much. The next day you can leave him slightly, right? So these kind of things can be done. And we have to give him positive reinforcement when he does something. So even if like apne baal bhi nahi banati hai, so I'll say even if she's held the comb and just done one stroke, give him or her a positive thing. Yes, you can do it. Great. Huh? Rather than saying kya ek baar kiya aur chhod diya, right? It is a huge thing for the person who is into deep depression. Now, you must know that there are various levels of depression. Very severe, mild, moderate, how much. So that is something which your doctors will decide. Now, I've told you about psychotherapy, then counseling. Counseling is when you give clarity and information to the person. He may have certain doubts. He may have some cognitive distortions. For example, he may feel nobody loves me. So in the therapy, we might ask him, is there any evidence for that? How did you believe it? How are you? What made you feel that? So we can have individual or group, individual therapy or counseling sessions are held for them. Then the deep breathing. I'd like to demonstrate this to you. If Vishal, you can, can you see me? So now I would like to give you some demonstration of deep breathing. In deep breathing, you take a deep breath in and then you release. Okay, it's like this. हमारे प्राणायाम में भी सिखाते हैं ये. डीप ब्रीदिंग के कई तरीके हैं. कुछ है, एक कुछ और ऐसे भी है कि you take a deep breath for 4 counts. Hold your breath for 4 counts. Relieve it for 6 counts. And then hold 2 again. And then start the cycling. Meditation, yoga, then there is this progressive muscular relaxation exercises. These are exercises which we do by making the person learn. He's made to lie down, and these are a series of exercises which start from the arms and then from head onwards, taking all parts of the body. We tell the person to tighten the muscles and to relax them. And they are found, so I would like some people, if they are interested in this, to go look up Jacobson's progressive muscle relaxation exercises. Then we have other techniques like guided imagery, positive self-talk. Positive self-talk is when the person says, okay, he acknowledges that I am not liking what's happening, but I'll come out of it. Right? How you can reinforce this in the person. This is the positive talk that we can, in a very graded way. आजकल हमें अच्छा नहीं लग रहा, पर हम इसमें से निकल आएंगे. So that he doesn't think that this is something for life. Right? Yes, at that time it can appear as a tsunami, as a whirlwind, as the earthquake. But tsunamis also go down. Earthquakes also heal. And basically, what is this tsunami? It is the lack of serotonin the lack of the biochemical activity which is taking place in the body. So therefore, treatment, the psychiatric treatment is a number one part of the treatment. But that is only one part of the treatment. Let me tell you that. The other part of the treatment, of counseling, of psychotherapy, of learning relaxation, of doing cognitive behavior therapy is very important, so that you understand that when the person continues to get negative thoughts, now what happens is when you get the same thought again and again and again, then it leads to distress. This distress leads to thoughts that I'm no good. See, every time this happens, and it leads to certain emotions and beliefs. Sometimes there is also I'll answer all these later, these questions. So later on, we also go ahead with teaching them how to repraise their life and priorities, improving interpersonal relationships. Maybe the person hasn't been talking, how we can initiate that, understanding responsibilities, whether it is job, home, family, friends. What is it that he gives importance to? What is important? So we don't rush him into things. And here I would like to, so we have psychiatric social workers also who come in between the persons, the employers and the patient. When he is not going for work, they go and explain that he is fine, he will be fine, and as and when he goes for he's going for therapy and treatment, and when he gets better, he will probably be able to resume. And then there is, if you can read the Mental Health Act, उसमें सारा आपको दिया जाएगा कि उसको कब कैसे उसकी फैसिलिटीज है, उसको मेडिसिन मिलनी चाहिए, टाइम से मिलनी चाहिए, उसका हक है. हम उसके साथ कोई एहसान नहीं कर रहे हैं. Mental patients, people with mental illness have rights. And how to give him a job which he can comfortably take over and do. It's not all or none. We can find something midways. Sometimes these people can be very non-assertive. So it's good to teach them assertive training, how not to say yes when you want to say no, because sometimes they just can't say no and they are overburdened with a lot of things. Another thing which goes here, how to teach them healthy coping skills. Now I'd like to tell you, blaming others and blaming your own self are no. Let's look at what is the behavior of the person that led to this situation and what is his attitude towards it. Rather than blaming, tune ye kar diya, tune wo kar diya. Another thing is, when you have, say, children who are depressed or whatever, instead of saying you haven't done this, we need to tell them that in a nice way, that what you really want from them. I wonder if you can help me in the kitchen. So it's something like the mother saying, you never help me in the kitchen. Another mother can say, I need help. Who is going to help me today? So it's something like that, where you bring the person to do the action, but in a totally healthy manner. So these are some of the cognitive distortions. Others are when he is saying something. Now that thing may be very, very important for him, but you are making it very micro. एक ह्यूज चीज हो रही है उसके साथ और आप उसको कह रहे नहीं ये तो होता ही रहता है ऐसे, ये कोई बात है, ये तो कोई बात नहीं है. सो अगर इतना आसान होता तो फिर वो उसमें क्यों धंसता. उसकी जो धारणाएं हैं बन चुकी हैं, हमने उनकी धारणाओं को कैसे, okay, we can tell him you have these thoughts, but your thoughts need not be correct. Is there any evidence for it? Is there any proof for it? Sometimes they can be doubting. लोग मेरे पीछे पड़े हुए हैं, वो मुझे मार देंगे, वो ये करेंगे. हम उनको ये भी नहीं कह सकते नहीं 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 कोई नहीं है, बिकॉज वो उसका है. अगर आप ऐसा करोगे वो तो मारेगा आपको. He'll become violent. If you, okay, so it's really happening, you are reinforcing. So you have to एक मध्य का रास्ता लेना चाहिए कि हमें लग तो नहीं रहा, पर अगर तुमको कुछ लगता है हम लोग किसी से जाके बात कर सकते हैं. And sometimes it's very difficult to bring them to the doctor concerned, to bring, because there is refusal. How to go about that, that is something to be learned. And I would like all of you to, because you know we all come through in the homes or in the office. If we are sensitive, we will be able to pick up these very subtle signs and symptoms. I have been going to schools and orphanages and places, even schools where there is suicide has taken place, and they've asked me to go and attend to these people. But what I want to tell you is some more things are there. In schools, you have to be all the more careful because there is an imitative behavior amongst others. So we have to give awareness to others. And teachers need to know the signs and symptoms. Which child is not participating a lot these days? Where there has been a death in the family, will he be more vulnerable? How to give him support at the trying time of his life? All these are very extremely important issues that have to be looked into. At your workplace also, somebody is not performing too well or whatever, we can sometimes say very clumsy, this is not done, or show our anger. I think if you can go, it will ask him, is there something or can we help? What is it that makes you not be able to do this? Is there something at home? Maybe he needs a time management. It's a time management problem and he's not able to complete. Maybe he's not understood the thing. So you see, at every level, we will need certain help from the environment and from family members. The best can be when family members can, and of course professionals are there because their training is on these lines, so it comes easily to them and they can do the talking in a sensible way. But today's talk, I'll just tell you that if you have been given these information now and there is clarity to you regarding the signs and symptoms and how people can help and what they can do, it'll go a long way in helping people with depression, and so that we can save a life and save the life timely. I think timely help is very, very important. So to that extent, become sensitive, do read about it, because it is like you can see there is such a high incidence. And another thing is, do not tell your children, especially male children, या तू लड़का होके तू रोता है, तू लड़का होके ऐसे feel करता है, please, this is not something that रोना सिर्फ औरतों को आता है या लड़कियों को आता है या उनका ही है. Banda Bantu, you know, I think let's become more educated. Right. Okay, so with this, I come to, you all have been very, very patient. It's a very long topic, so it's not so easily squeezed into a 20-minute talk. But if you've got little information, some clarity, some information about it, I think it's worth it.
Thank you,
Thank
Doctor.
you so much.
Thank you so much. It was such a wonderful session, hearing both of you. And believe me, I can only say is that we are a part of that transition phase. That probably 20 years ago, if I would have told my parents also that I need to see a psychiatrist, to get it to pagal hai. But today they say, no, you must go today only, not tomorrow, but today, whether it is psychiatrist, psychologist. So the importance of psychiatrist and psychologist is very well known in this world. And it's actually important, as you both have pointed out. We can well imagine that even we have counselors in schools also, which is recognized that now depressions were earlier a part of 50, 60, 70-year-old people, old age people who used to be left alone. But today there is no age limit defined for it. And Dr. Monika Singh, thank you very much. Till date, we've just heard that men don't cry, but today you told us that even we have the liberty to cry. We are very much.
Of course. It is okay to cry. It is okay to give birth. The only thing is, if you are unable to stop your emotional thing for days and days and going, then please look for someone. Because it may be a little more deeper than that.
And crying doesn't make you weak,
That's right.
It's not
a sign of weakness.
It's not a sign of weakness.
So we'll start with our question answers now. There is a common question which everyone in fact would have it, that some of the signs you say today is something which would be actually visible in all, be it depression, be it feelings, especially in Corona for 3.5 months, people are sitting home, idle, maybe some of them. Some signs would be pretty normal. How to distinguish that it has actually come to the stage of depression, and how to distinguish that, and when to feel that the person in our family or oneself itself should now go for treatment, that it has become a depression.
Yes, that's a very, very interesting question. Need of the art. I told you 3 phases of sadness. Number 1, low mood, and then there is sadness, and then is clinical depression. Low mood is, all of us are into this phase. Even we people are into low mood. But this wanes off, comes in, wanes off. And sadness is when there is an event like this, Corona and lockdown. And if it's proportionate to that, a sadness, a low mood is proportional to that, we're not able to move out, we feel little tight, pack kiya hua hai, band kar rakha hai. If it goes beyond that, it's disproportionate. And it's affecting your day-to-day working. That's very, very important. Every individual on this earth, every living organism on this earth is created to do some work. If you are not able to accomplish that for a couple of weeks, we say 3 weeks is the time when depression is labeled, then you should meet a medical professional, maybe psychologist or psychiatrist.
Thank you, doctor. Thank you so much.
I'd just like to make a point that if you have a doubt that this person is sliding into it, there is a change from the earlier days, and it's a drastic change which has happened over time. I think please get the clarity and go and get a checkup. It's better to rule out than to suffer.
The next question is from Ma'am Rupali Shekhar Verma. You can please unmute yourself and ask the question. She's raised her hand.
Hello, Vishal, am I audible?
Yes, you're audible, ma'am.
Monika ma'am, my question is very practical actually. These days, in the era of this social networking and all, there are some signs which are being thrown on social media. How important these signs are, like somebody is posting something negative or low as on Facebook or WhatsApp status, how serious or how relevant these signs are, and how we can approach that somebody telling him or her that there is something which needs to be done, or we can approach the family of the person who is showing such signs. So are these signs first of all relevant? And if yes, then how can we as an outsider can approach the person?
So first of all, it's a very good thing because this gives you the awareness, not only about your family or something, but even for people outside, that you are that aware that, you know, these things are there. Now, I'll tell you something. There's a lot of information available on YouTube, on internet, and we get WhatsApp messages and all that. But in case you have a doubt, because, you know, the clinical part is very different from what you are saying. But if you feel that, you know, these kind of symptoms lag rahe hain usme mujhe, kuch mujhe lag raha hai, you know, koi tabdili to aayi hai, then I think you can approach the family members and find out more details कि उसका मन बुझा तो नहीं है, वो खाना ठीक खा रहा है आजकल, लोगों में बैठता है कि नहीं, पहले जैसे एंजॉयमेंट करता है कि नहीं, अपने कमरे से ही ना निकल रहा हो. You know, there are so many signs and symptoms that are there. Then it is best that...
And again,
you mean to say that we need to corroborate, like we need to establish this fact that yes, he is going through this depression. But my another question was that is it possible for a family like to convince the family that yes, these signs are also relevant, because sometimes we are more sensitive towards some people, or we are more sensitive towards our associates. I have experienced this thing mainly in my associates, ma'am. Sometimes their WhatsApp statuses are very gloomy and very dull. So I sometimes feel that this is something is not right somewhere. But talking to the family straight away is also a problem. So can we on our part also do something?
I think it can be done very skillfully. This is something which is very correctly coming in your mind, because approaching this topic is a very sensitive issue.
Yes,
right? So that is why when you first approach it, you have to have a very good rapport, even with the family members. They need to have that trust in you, that you are well-meaning. It's not just to lose stock. You understand? It's not just, you have to, your body language, eye contact, your appropriate nod will give them all the, they will be assured that you are a genuine person wanting to impart help.
Yes, ma'am.
Right?
Thank you so much.
This is it. Yes.
I want to add one thing to it. If such posts are persistent,
yes, ma'am,
definitely we should go in for help. We should go in for to help the family, and a rapport definitely is very important. If you don't have a rapport, definitely nobody will believe.
Next question is from Dr. Anand Bishnoi. You can unmute yourself, please, and ask. Dr. Anand Bishnoi, are you there? I think he's not here. Manish Bahalji, you wanted to ask a question? Please unmute yourself and you can ask a question.
Yeah, good evening, ma'am. Good evening, sir. Nowadays, what we have heard is this: the case of Sushant Rajput, this nepotism, favoritism. Is this a depression in the society? This favoritism, nepotism.
Such things do happen in all societies, in all eras.
In the case of Sushant Rajput, what we have learned from the social media or from everywhere.
What social media is talking, what TV.
They are saying that because of the favoritism in the entire Bollywood, because of that very reason, he has committed suicide because he was depressed.
That's where we are coming.
This is his coping.
Sorry?
That's where we are coming. That's where we're coming. This nepotism, favoritism is all there, all times, every field. So, what the social media debates are going on, this really rubbish, I'll say. This is detrimental to the society. And he was depressed. He had poor coping mechanisms. So he landed up, he was under treatment. He didn't take treatment. He didn't take treatment properly. So he committed suicide. It's one of the things, in depressed patients. He had poor social support system. Family was not living with him. So all these things did attribute to his death.
Another feather into the hat.
Yeah. There's another question on the Facebook which has been posted. It says one cannot do anything or one cannot do anything in his area of interest. Do both imply same thing? Are these thoughts signs of depression?
This is too short and this is too little an information to imply depression is there. Maybe he is having low self-esteem. Definitely, the two things, they're definitely different. I can't do anything as little more severer form of negative thinking as I can't do this or I can't do anything.
There's another question, although you've already answered it, but our viewers wanted to be answered again. They say that I've observed that people are reluctant to take psychiatric medicines because they feel that once the medication starts, it is very difficult to leave them. Even we see people take them for years and years. Your take on this, please.
Definitely. This is a very important question. I did try to answer it, try to elaborate it on during my talk. I told you depression is an illness. This is because of decreased level of some chemicals in the brain. We replenish it with medicines. 85% chances are that they'll be recovered of its own. अपने आप वो chemicals की कमी पूरी हो जाए. So usual treatment course is 1 year or so, but definitely 15% patients are there. It's more visible definitely. वो हमेशा रहते हैं. So 15% patients are there who need lifelong treatment because उनके serotonin levels द्वारा पूरे नहीं होते उन chemicals. There's no doubt about it. But it's not a generalized statement. Under good hands, we try to taper off treatment after 9 months, and 3 to 4 months away we take off treatment. Most of the patients, that's about.
Okay. There is a question. They say, is there a way a person can self-diagnose if they're going into depression?
Definitely. Patient who has already suffered, number one, they are the ones जिनको पहले अटैक हो चुका है डिप्रेशन का, उस सेकंड एपिसोड में they know it कि डॉक्टर साहब मेरे को वैसा ही दौरा फील होने लगा है, 6 साल पहले हुआ था. टुडे ओनली अ पेशेंट केम टू मी, सबसे पहले तो मैं सुसाइडल था, लेकिन मेरे को लग रहा है मैं उसी स्टेज में जा रहा हूँ. मेरे को मन नहीं करता, ऑफिस में मैं चिड़चिड़ा रहता हूँ, बीवी से लड़ता हूँ, बच्चों को पीटता हूँ. आई नीड योर हेल्प. टुडे ओनली दे कैन. एंड इफ यू आर अवेयर ऑफ इट through social media, through this Google uncle, definitely you can.
Okay. Is there anyone else who wants to ask a question? Anyone can raise the hand or unmute themselves. I think.
Hello,
yes,
sir.
yes.
I just like to ask if, apart from the allopathic medicine, is there a treatment in Ayurvedic medicine also for depression?
This is an area less explored, I'll say. We are not taught about it. Definitely yoga do have a role in maintaining mental health. I will not say treating mental, maintaining mental health. Ayurveda, I have not read it, learned it during a course, even after that. Sorry for that.
The practitioners of Ayurveda, they do claim that they are very, very effective in soothing the nerves and everything.
We don't doubt them because जिस चीज के बारे में knowledge नहीं है, we don't have right to comment on that.
Certainly.
Anyone else for the questions, please?
Vishal, there's a question on Facebook. Have you asked?
I've read that.
Thank you.
It's time to end the session. What a wonderful session it has been. And I again thank both the doctors for devoting so much of time and taking out time from the busy schedules. I've seen both of them personally. They're very, very busy, and today they've taken time. And now I'll just hand it over to Mrs. Ruchita Garg. Please.
Thank you so much, Mr. Vishal. I could quote something that is, when you are surrounded by all the people, it can be lonelier than when you are by yourself. You can be in a huge crowd, but if you don't feel like you can trust anyone or talk to anybody, you feel like you are really alone. So that's what our honorable speakers has spoke about it. I am highly obliged that I have given a chance to speak, to express my vote of thanks to our honorable and learned speakers, Dr. Anil Goyal, he's a senior psychiatrist, and Dr. Monika Singh, who's a consultant clinical psychologist, on our today's webinar. On behalf of the informal webinars team, I extend a very hearty vote of thanks to the both speakers who blessed us with their presence and took out valuable time of your busy schedules, sir and ma'am. I must mention a deep sense of appreciation for the knowledge and for gracing the important work and sharing us with your experience in such a required field that is required these days. It is a very important topic, and I think we all need to handle with it these days. As Sir has told that depression causes the persistent feeling of sadness or the loss of interest in the activities which were enjoyable before and causes significant disability in the functioning of daily life. So even he has told about that it is a common misconception that depression means being sad or crying a lot or dressing an emo to be dramatic or to show sadness. It is a lot more than that. So on the whole, I just could say that depression is a feeling of numbness. It is a feeling of numb to emotions and to everything in life. I really thank both the doctors that they have made us clear about these two things, this depression, the problem of depression in a very elaborative way. They have given inclusive sight towards the topic. Thank you so much, Dr. Anil and Dr. Monika Singh, for telling us about the depression, its recognition, that we should take it as a cohabitant with the anxiety, as Sir had told us earlier. We should detect it at an early stage, all these kind of things. Beside all this, I will thank to the teams also who has been doing very hard to make the event, to make these webinars successful. I thank Mr. Vishal, Mr. Padamkant Vedi ji, and to all the volunteers. And beside all this, I would like to thank Dr. Jyoti Sharma, who has introduced us with both the doctors very well. Thank you so much for the guidance and for everything that we have been provided by the team and to this speaker. Thank you so much.
Thank you,